The David Pakman Show at davidpakman.com.
All right, so I know that some people are not going to like this segment, and that's okay as long as we're able to have a productive conversation about it. And I put aside the time on today's show to actually be able to do this. We are about to head into an election of extreme importance insofar as the removal of Donald Trump. This is not just politically based, but there are a number of different just systemic weaknesses in our democracy by virtue of having Donald Trump in the Oval Office. We're looking now at a delay of the census, which I'll talk about on tomorrow's program, relationships with countries abroad. I mean, this is way bigger than Republicans and Democrats. And more Republicans, by the way, are understanding this when it comes to Donald Trump. We cannot be distracted on the left by self-destructive impulses. And last week I did live streams of the two debates, the one debate that was split into two nights. And after the second night of debating ended with the Democrats, I took some live calls. And I got a live call from a woman who wanted to explain to me that there can be no such thing as racism against white people, and there can be no such thing as racism by people of color or minorities in the United States. Now, I got pretty agitated during the call, and now that a few days have gone by, I've sort of reflected on why and realized that it's not the disagreement in and of itself that I found so disturbing and so agitating, but it's that the conversation in and of itself is one that, when it becomes as toxic as it did, is the type of thing that can either destroy the left or potentially seriously hurt us. And I don't want to see that happen. So I'm going to play the full clip for you because I don't want to take any one piece of it out of context. This is the full conversation I had during live calls after the debate last week from a caller saying, white people can't be the victims of racism. Non-white people can't be racist in the United States. Take a listen to this. Let's see who else we've got here. Let's go to, I don't know. I mean, I'm just going crazy here with area codes. Let's try the, something's up with the phone system. There's almost like too many people holding. Let's try the 561 area code. Who's calling today from 561?
Hello? Me?
Yes, that's you.
Am I live?
You're
oh my
live right
God,
now.
Yes. Hello, David Pakman. This is great. So basically, I have a question. It's not really relating to the debate, but I called way before, and it was I think it was mentioned on your interview with the Joe Rogan show, and it was about that tweet of that one woman who tried to get you fired from Boston College because you tweeted that it's not progressive to vote for someone or not vote for someone based off of their race, gender, whatever. Do you remember that?
Yeah. I said that excluding candidates merely because of their race or gender is not progressive, and she tried to get me fired from Boston College for saying that.
Right. So what you said on the Joe Rogan show, it implied that what she was saying was racist. And I called asking what you thought about that because racism isn't applicable to white people. And I really wanted to hear your thoughts on that because, yeah.
Who says you can't be racist against white people?
Well, okay, we have to really take a look at what racism is, because if we're going by the definition that it's discriminating or seeing a race as above or below another, that's a very skewed definition where racism should be examining the social, economic, and political system. And within this nation and other Anglo-Saxon nations, there's only one group, the in-group, which are white people, that have the political, socio-economic power to oppress.
No, totally disagree with you. I think that's a losing redefinition of racism. You can be there's no question that power dynamics are really important in thinking about whether racism translates into structural oppression. But you can be racist no matter what your race is, and no matter what other people's race is.
I think it's
But
what you're
why do
saying
you
is
see it-
extremely
but why do you-
problematic.
But why is my definition problematic when it takes into account the historical implications of what white people as a group have done to oppress people of color?
It's just
Like,
not.
what
It's
is
just
your
not the right.
definition
It's
of
just not
racism?
accurate. The first definition you
But
gave is
what
the
is
right one,
accurate?
and so I think there's two things.
But why is
A
that
white,
accurate?
because it's not what racism means. You're coming up with a new definition. It's like if I said, you know,
But
I'm
I'm
going to
not
read.
coming up with a
Hold
new
on a second.
definition.
Well, you've presented another definition, right?
And I think I'm presenting the most accurate and holistic definition of racism.
And that's what. So for you, the most accurate definition of racism is one in which no one can be racist against white people. Is that what you're saying?
I'm not saying that. I'm not saying
That's
that.
what you said. That's how you
I'm
started the
saying-
conversation. You said you can't be
I
racist
started
against
the
white people
conversation-
in Western
can't be
Anglo-Saxon
racist against-
countries.
You can't be racist, at least in this nation. In this nation specifically, because that's what I've studied with racism. This nation specifically, you can't be racist to white people because people of color don't have the power.
Okay,
as
hold on a
to
second.
be
Just hold
racist.
on 1 second, okay? Let's just take it. Let's build it up. If a Hispanic person says, "I don't like white people because they're white," is that racist?
No, it's not racist. However,
Hold on a second. How is
however,
that not
it's
racist? No,
racially-
however, just how is it not racist?
It's not racist because I can't say Hispanic because Hispanic is an ethnicity. So I understand what you mean by, let's say, person of color. A person of color cannot be racist towards a white person because they don't have the power.
Okay, all right,
the
fine. So
outgroup
we're going through. Just indulge me. If a person of color says, "I don't like white people because of their whiteness," that's not racist according to you. If
It's
a
not
hold on.
racist, it's
If a
racially
company
bigoted.
says, "We are not going to hire white people at this company," is that racist?
Yeah, it's racially bigoted. It's racially bigoted.
All right.
Like, I think it's
The
important
slice
to
of the
really-
left that you represent is very small, but it is extremely problematic, and I completely disagree with you.
Okay, David, or Mr. Pac-Man, however I want to address you. I follow you because I think you're really reasonable, and I subscribe to you, and I think it's great what you do.
And what you're saying is extraordinarily unreasonable. Trust in my reason, then.
However, what I'm saying is not like some conspiracy theorist,
No, it's not. It's just wrong.
Idea. It's not wrong because we have people studying race and racism for decades, and anthropologists have come together to
You're
come to
just
this
wrong.
conclusion that
Listen, hold on a
racism
second.
is prejudice for power.
I'm a Hispanic immigrant to this country. If I said
Yes,
I
but
am
you are
going
a
to
white
enact it,
Hispanic
hold on a
immigrant.
second.
You are a white.
If you really want to get down into ethnicity, I'm actually Ashkenazi. But this is why this is so stupid. If I say, no matter what my race is, if I'm white, if I'm Hispanic, if I'm Ashkenazi, if I said the David Pakman Show is not going to hire white people as a policy because I just don't like having white people around, that is racist by any definition of the word, and any deviation from that is completely counterproductive.
It's racially prejudiced, but racism needs to take the holistic definition of prejudice plus power.
Listen,
and
now you're just playing semantic games. I'm going to let you go because the audience, I think, is tuning out, but you're just wrong. Yeah. I would urge you to rethink your views, and I hope that does not infect any of the Democratic candidates' dialogue, because that is what you're saying is a disaster. It's extraordinarily damaging, and fortunately, I don't think it's super prevalent, because what you're saying doesn't make any sense. Okay. Wow. I mean, I'm shocked by that.
So the mistake I made in this clip, aside from just getting more agitated than I might have wanted to, is that I actually completely missed really getting into the big picture of what's wrong here. Because, yeah, I mean, racism doesn't require systemic oppression to be racism. I would have been better off during the call distinguishing and saying, I appreciate your perspective. I think we're talking about the difference between racism and systemic or structural oppression on on the basis of racist beliefs. Racism can exist without using those racist beliefs to oppress a particular group of people. Either way, it's racism, right? Whether it's racism plus oppression or racism without oppression, either way, it's racism. But now that I've actually had some more time to reflect about the call, and I talked to a bunch of people about it over the weekend, the real problem here is that this type of argument literally prevents actually talking about solutions. What I mean by that is, I've talked about the narcissism of small differences before. I've talked about the importance of not missing the forest for the trees when we talk about politics and policy and what we want to see. I believe that clearly people of color can be racist. I believe that obviously white people can be the victims of racism. The requiring oppression to be racist makes no sense to me, in the same way that if you have a KKK member in the middle of West Virginia with racist beliefs, but no resources to actually oppress anybody, living in a rural place where there isn't even anybody to oppress, that's still a racist, right? In the same way, a person of color can be racist against white people. They may or may not have the ability, resources, wherewithal, or circumstances to oppress white people because those people are white, but they can still be racist. But here's the real issue. This caller and I would guess, would agree that in the United States, the issues of racism have to be sort of understood big picture. And that mostly issues of racism in the United States are racism against people of color, not racism against white people. The caller and I'm guessing, would agree that in the United States, historically, most racism, but not all, has been against people of color and not by them, and it has been by white people and not against them. That's a historical reality. But look at how this, however long it was, 6-minute conversation, we end up in an argument that's not only unwinnable. She was totally set in this idea that white people simply cannot be the victims of racism, period, like in an a priori sense. It's an argument that will never solve anything. Imagine that I argued with her for an additional hour, and imagine that she got me to agree, okay, you know what, you're right. You can't be racist against white people. It would do nothing for the majority of victims of racism in the United States, who are people of color in the United States. This is completely self-destructive. It's energy and time that is being spent on something that is not going to achieve change for us. It is not going to put us in a better position to put leaders in place that are going to do good things rather than bad things for us. So the argument about whether a person of color can be racist. Where are the lines between ethnicities? I'm of Hispanic culture, but a white person, but at the same time, I'm Ashkenazi, which anti-Semites say are not actually white people, but I still look white and speak without an accent. Which category? This is a loser's argument. The argument does nothing for us in trying to fix the issues that we're facing in the United States. It does nothing for us in trying to replace Donald Trump with the most progressive possible candidate, whoever we believe that to be. And that's really why I was so frustrated. Okay. Someone disagrees with me about the definition of racism. I understand the prejudice plus power definition of racism has been around in academic settings and sociology departments for a while. It can be debated. I mean, the caller presented it as obviously that's the right definition. Well, the idea that you need prejudice plus power and oppression for something to qualify as racism is not something that is unanimously agreed upon. I don't even want to get into that debate again because I think that is secondary or even tertiary here. The argument I had with the caller does nothing for me, and I wish that I had instead said, hey, you know what? I actually don't think it matters how we each define racism. I think you're obviously wrong, by the way. Let's figure out what policies we want in order to ease the issues that are biased along racial lines in the United States. My guess is, and I hope I'm not, I mean, I'm being charitable. I hope I'm not being overly charitable. I know some people will hear this and they'll say, David, you were not going to have any sensible conversation with that person. I think maybe we could have. My guess is that mostly our list of problems could be fixed and policy prescriptions could be agreed upon, even if we couldn't agree as to the definition of racism, which again, I totally agree with that caller about. So let me know what you think, because my concern is that is the type of argument which, number one, is completely fruitless in terms of what we would gain from continuing for an additional 16 minutes instead of just 6, or 60 minutes or 600 minutes. And if the left gets pulled into that type of stuff, it is going to take attention. It is going to take resources, and time is a resource, and other resources, away from actually making the decisions and becoming activists to really affect change. And that is why I found it so agitating and frustrating. I want to know what you think, okay? I'm on Twitter at dpacman. The show is on Twitter at David Pakman Show. Was that a debate worth having or not? How big a slice of the left do you believe that ideology represents? And am I generally right that it is a distractive and potentially self-destructive path for the left to go down at a time where we are approaching such an important election in the United States of America? Let me know. Twitter at dpacman.
The David Pakman Show at davidpakman.com. The David Pakman Show at davidpakman.com.
Okay, let's say a couple of thank yous. Today's two new David Pakman Show members of the day are Iria V and Ricky Jara. Thanks to both of you. Really appreciate your support. This program is primarily and mostly funded by memberships, which you can get in under a minute at www.joinpakman.com. The longer you stay a member, the better it is for everybody, that's for sure. And James Watts has been a member for almost 5 years. He's today's longtime sustaining member of the day. James, really appreciate your support. Almost 5 years of membership. That's a long time. Coupon code is available if you want to save 40% off of your membership. You get all the benefits, but you get a 40% discount off of the price. You can use the coupon code THISIS2020 on any membership at www.joinpakman.com. Okay, things are sort of mixed up this week because of the 4th of July holiday. So the Wednesday show is going to be the day we take live calls instead of the Friday show. That would cause us to miss out on Hatriot Mail, which a lot of people don't want to do. So we are going to get to Hatriot Mail a day early. Today, quick reminder, what is Hatriot Mail? This is Hatriot Mail.
Hey, we'd probably poison our entire family if Trump told us to. But remember, it's not a cult. Patriot Mail. Written by patriots who hate David Pakman. Because America. And because freedom.
Okay, this week's Hatriot Mail, picking up on a theme from Donald Trump's State of the Union address and that has continued, which is the theme of this is not going to become a communist country, which of course is a total straw man talking point because there's really no threat of the United States becoming a communist country. Take a listen to this.
Pakman is a wishy-washy wordsmithing Jew, using vague terms like progressives, when it's all if cover for social democracy, socialism, communism, anarchism, etc. Progressive doesn't mean shit. Just because a vague idea of progress is involved, it communist, specific kind as progress. They see it as conservatism in human clothes. We will never be communists. MAGSA.
Yeah, MAGSA, some kind of make America greatly stupid again, I guess is what MAGSA would mean. I'm going to assume that's a typo based on the proximity of A and S on computer keyboards. The number one way to fight patriotism and to push back against it is to sign up for a David Pakman Show membership and use the coupon code HATRIOT40. The coupon code HATRIOT40 saves you 40%. off of a membership. You get all of the same member benefits as everybody else who paid full price. And Hatriots don't like it when their Hatriotism leads to membership. Hatriot40 is the coupon code. It'll save you 40% off of the membership of your choice at www.joinpacman.com. Okay, last week I did a fully detailed breakdown of exactly how it is that the YouTube algorithm is doing a lot to hurt the David Pakman Show. And last week I focused mostly on the ways in which our traffic from YouTube's suggested video feed has fallen off of a cliff. And that story resonated with people hugely. The YouTube clip that we did where I just explained, here is how the YouTube algorithm is crushing us when it comes to suggesting our content, has surpassed 200,000 views in just a few days. And as a reminder, in case you didn't see that or you forgot about it, we used to regularly get about 3.5 million views per month from YouTube, including our content in the suggested videos. So this means that you're browsing around content on YouTube that is not David Pakman Show content, and alongside it or down below it, YouTube will say, hey, here's some stuff that you might like, and some of those clips are from the David Pakman Show. We used to get, as I said, about 3.5 million views per month from that algorithmic series of suggestions. That number dropped to barely 1.5 million in June. So the shortfall just in that bucket of views, the suggested content from YouTube, is 2 million views per month. Okay? A drop of 2 million views per month. Listen, most YouTube channels don't get 2 million views a year, never mind per month. And for us, our shortfall in views just from the suggested video algorithm is about 2 million views per month. That's a huge amount of revenue for us. As I've said before, YouTube's terms and conditions don't allow partners to talk specifically about revenue, but it's a lot of money to lose 2 million views a month just from that. And what it appears is happening is that YouTube is recommending more establishment, legacy, corporate channels over the David Pakman Show. So whereas before, if you went and looked at a clip of whatever, Stephen Colbert, along the side, previously, it was more likely that a David Pakman Show video would be recommended. Now, it's more likely that you're going to get recommendations from CNN, from the other late night talk shows, from establishment, legacy, corporate sources. So this is a direct negative to independent media sources like ours. I also last week alluded to another piece of the problem, and this is a completely unrelated problem that's also absolutely destructive. And it makes me wonder, is YouTube trying to get me to quit? Are they trying to get me to just stop doing what we do? And the problem is what I would consider completely brand-safe videos with nothing controversial, nothing problematic, nothing gory or violent or anything like that, being demonetized individually. This is a double crush of the David Pakman Show YouTube channel, because on the one hand, YouTube is recommending our content less frequently, instead recommending corporate legacy content. And on the other hand, it's making it so that even when our subscribers come to our channel and watch our content, more and more of those videos aren't running ads, meaning that we end up earning no revenue from those videos even when people do watch them. And this has now exploded in the last 3 or 4 days with completely innocuous videos being completely demonetized, and it's happening very often to videos that do really, really well. This next example should stun you. Yesterday we did a story. The story was about Donald Trump's press conference over the weekend in Japan. The video was called "Visibly Sweaty Trump Confused by Busing and Liberalism." The video's 9 minutes long. It contains no profanity. It contains no descriptions of violence. It's not at all about anything gory. There's no gory images or vocabulary. There's no discussions of war or terrorism or anything like it. There's no mention of race or racism in the title, in the description, in the tags. It's 2 clips of Trump talking to reporters, Kristen Welker and I believe Peter Alexander, at a press conference in Japan. The video was instantly demonetized when we uploaded it to YouTube. Now, this doesn't mean when it published, it was demonetized because somebody complained about the video or whatever the case may be. Before it even published, just when we uploaded it, it was automatically demonetized by YouTube's algorithm. Here's a screenshot. The yellow dollar sign signifies that the video has been marked as not brand safe, meaning we make no money from it. And despite YouTube having told me a couple of weeks ago that they will be, when we believe that the algorithm has incorrectly identified a video as not eligible for monetization, they say you press the appeal button, and we're going to try to review those appeals within an hour or as close to it as possible. 16 hours later, as of this morning, the video still demonetized after 150,000 views in the first 16 hours. This is a really good video for us. 10,000 views an hour for 16 hours is very solid for us. And completely lost revenue on it that we will never regain. We spend time researching and gathering the clips. We prepare a commentary. We edit the video. We upload it. It gets a bunch of views and engagement and comments, and we lose all the revenue because of this demonetization. Now, let me be very clear. This is not about me thinking I have a right to monetize on YouTube. YouTube can have a policy. YouTube can monetize or demonetize whoever they want, assuming that they're not, for example, targeting people on the basis of their race or ethnicity or religion. As long as they're not saying any videos done by people of X race, we will not monetize. That, I believe, would be against the law. But I have no right to YouTube ad revenue. So I don't want the conservatives to misunderstand my argument. The problem is we're playing the game the way YouTube wants us to play it. We're uploading content that is not in violation of any of the terms and conditions for monetization. I'm not even arguing that this is a left versus right thing. There are left-wingers who are having this problem, and there are right-wingers who are having this problem. If I had been, for example, uploading videos where I am bullying a specific YouTuber or journalist for their race or their sexual orientation, okay, that I understand. If we were showing footage of bloody military conflicts, even though, by the way, I think it's actually good for us not to be disconnected from the bloody reality and the horrors of war, I understand that brands don't necessarily want to advertise on videos that contain violent war footage, for example. But it's none of that. And in the last month, YouTube has taken a decidedly anti-independent turn. I believe that that's what this is about. They are suggesting more and more corporate legacy videos over independently produced videos in news and politics. They are monetizing corporate legacy videos on the same topics over which we are being demonetized. And now that a ton of you have heard about this, many of you have fortunately said we're not going to allow this to happen, and I have to thank you for that. June ended up being our biggest month ever for new members, and we have to keep it going. And I've run some numbers. If we have 3 more months of new members like we had in June, we will be able to laugh away this demonetization issue, and we will be able to just do the content, and it won't matter what's monetized. So if you don't like what's going on here, and I know that there are people on both sides of the political aisle that don't like this, just pick up a membership, okay? This is really cheap. Every person that signs up is giving us immunity from this fiasco. Every dollar we receive through membership is a dollar we don't need or have to worry about from YouTube. We're not going to go away assuming they don't ban us, okay? Make sure you subscribe to our channel. Make sure you hit the bell icon and tell YouTube you actually want to be notified when we post video content. Keep watching the clips. And please sign up for a membership if you can. It has not been going well on YouTube lately. But thanks to you, we are building a stronger foundation. So we will hopefully be less exposed to the whims of the YouTube monetization algorithm. And by the way, if you go to davidpakman.com/membership and the prices strike you as high for your budget, I totally understand that. Use the coupon code THISIS2020. It'll chop 40% off the cost of your membership. Let me know what you think about this. I'm on Instagram at david.pacman, the show on Instagram at davidpacmanshow. I will keep you apprised of developments in this area because I know that many of you do care about what's going on.
The David Pakman Show at davidpakman.com. Welcome back to the David Pakman Show.
It's great to welcome to the program today Dr. Marty Makary, who's a Johns Hopkins surgeon and a New York Times best-selling author. His book, The Price We Pay, What Broke American Healthcare and How to Fix It, is available now on Amazon. I think a good place to start is what did break American healthcare? I mean, former Cigna executive Wendell Potter writes in his very good book, Deadly Spin, about how in the period between World War I and World War II, the U.S. was sort of headed in the direction of a system more like many of the European systems. But at the time, it seemed too German when we were not getting along well with Germany. That plan was abandoned, and that was sort of the beginning of the plan and the system that we have now. How do you see the crux of how we got to where we are now?
Well, people have a lot of opinions, David, on healthcare, and everybody has their own experience or their interface, even doctors. We tend to see it from our vantage point in our specialty. But if we look broadly at the entire system, and we actually are not beholden to any particular special interest or stakeholder and can talk openly and honestly with a critical view of the entire system, it's really two fundamental root problems. Number one, pricing failures, and number two, inappropriate care or the appropriateness of care. If we look at the loss of competition in healthcare and how you can't get a price for basic services, people have a right to be angry. And when those services 20% of the time are unnecessary, which is what our research from Johns Hopkins has shown in a national survey of U.S. doctors, they say 21% on average of all medical care is unnecessary, testing, even procedures, medications. These are the two fundamental areas that we can improve. And in the book, The Price We Pay, I tried to find the disruptors nationally who are actually fixing healthcare by addressing these two underlying root problems.
Now, there are different philosophies that would have one person hear what you just laid out and go in the direction of, well, the solution would be total free market, for profit, let everybody shop and do exactly whatever it is they want, let the sort of laissez-faire approach fix the problem. And there are others who would hear what you said and say, oh, no, we need a completely different system. We need one actually where we can have bigger parties negotiating on our behalf, up to and including the government through some kind of single payer system. Which does one or the other strike you as the best path forward to solve the two problems you outline?
Well, to be very honest, David, I actually think that there's tremendous consensus in the United States, if we can lay out the issues for what they really are, that price gouging is wrong, and that price gouging happens today, and it will continue to happen if the government is the payer. And by the way, the government does not have a great track record as being a very good negotiator. When you deliver a baby in Boston, you can have that done for $6,000 or $41,000, both at Harvard hospitals. There's no difference in quality. These are sometimes the same doctors. Price gouging has sadly become a way of doing business. And if we can get rid of the waste in the system, that entire spend that makes a lot of people rich in healthcare, but is wasted money, we could create efficient marketplaces and actually cut the waste in a way that's bipartisan, and it retains the private health insurance system, and at the same time keeps the healthy Medicare government payer system going strong.
So it sounds like you're saying you wouldn't necessarily want to expand any government involvement. You would want to keep Medicare and maybe Medicaid, but you would want to improve the for-profit healthcare system that we have. Is that what I'm hearing?
Well, I applaud people who find Medicare for All attractive because they want to get rid of the waste. The problem is down the stream, long term, 100% of the time in every country around the world, including our own, long term governments tighten the belt on healthcare expenditures, and you can be left with a dilapidated system at 10 or 20 years. If we want to cut the waste, which is where I think there's broad consensus, we can do that by creating transparency within the system. I opened the book, The Price We Pay, with a group of doctors in the Washington, D.C. area that are gouging Medicare, that are taking advantage of the system, that our taxpayers are funding a group of doctors doing unnecessary procedures all day long. That will continue with Medicare for All. That doesn't stop. So if we just look at with competition and transparency, we can actually reduce the waste, because I personally believe, David, that we already spend enough money in America to give everybody gold-plated health care.
Oh, yeah. There's no question that we do. I guess I'm not sure that I agree with you because, yeah, okay, so I think if you say to basically any American, do you want to get rid of waste in the healthcare system? Basically every American would say, yes, I do want to get rid of waste. The problem is that many Americans see profit in an area where there is completely inelastic demand as part of the waste that should be removed. There are people who see a system that requires medical billing experts on both the insurance side and the provider side as a form of waste which we could get rid of through some kind of government-centered program. So I do agree with you that waste is bad and Americans want to get rid of it. I don't think that there is as much agreement as maybe you're suggesting as to what constitutes that waste, though.
Well, if we can agree that there's a tremendous amount of waste, if we can agree that walking into a New York hospital and having a bill of $70,000 is egregious when the market price is 6 to 7.
Sure.
There's a tremendous amount of waste there that can be cut without all of the infighting that's partisan about what's the great philosophy to dominate healthcare. This is the low-hanging fruit in the system. And trust me, nobody has been more aggressive in fighting the profiteering philosophy in medicine that has taken over and ruined the medical profession in certain pockets of America than me and my team. We go to hospitals, we call out CEOs. We just did a giant expose of hospitals that sue patients in the state of Virginia. A study that came out this week in JAMA showed that some hospitals, about 10%, aggressively take their patients to court when they can't afford their bill. We have called them out, and the hospital that was the worst offender announced they are going to stop suing patients as a result of our work in the NPR piece that ensued. So we have been calling out people that have been using profit to take advantage of people all across the country, and you're absolutely right. It's wrong. It erodes the great public trust of our medical profession, right? Hospitals were built to be a safe haven, a refuge for the sick and injured, regardless of their race, creed, or ability to pay. That is the charter of most U.S. hospitals, many of which were built on charity or built by churches or by land grants from the community.
Yeah, so let's focus in on that a little bit, because that may be something my audience doesn't know about. I think my audience probably understands the philosophical differences sort of underlying the idea of these systems that we're talking about. Talk a little bit about the fact that there are lawsuits against patients by hospitals. Talk about the wage garnishment also, that I think many in my audience have no idea is even a thing, that hospitals do have mechanisms for actually garnishing the wages of former patients for unpaid medical bills.
Sure. Well, my research team started looking at the markup on medical bills, identifying extreme outlier facilities, hospitals, even physicians who are charging 23 times more than what the Medicare allowable amount is. When we would approach hospital CEOs around the country and ask them, why are you charging 5 times more than the next hospital that sees the same case mix and payer mix? The answer was always, well, we have secretly negotiated contracts with insurance. Don't worry, Marty, nobody pays those bills. So we did some research and found out, no, a lot of people are expected to pay that bill in full. And those people are expected to pay that bill, and if they don't, they're taken to court and sued by a hospital and have their paycheck garnished or liens put on their homes. And we found one hospital that has sued 24,000 people in a town that, by census data, has 28,000 people living in it. We went to New Mexico, and in the book, The Price We Pay, I visited some of these courthouses where we found the courthouse transformed into a taxpayer-funded collections agency for the hospital. Lives ruined. I mean, these are hardworking Americans who've been financially devastated, right? Most people don't live like you and I, David, right? We are relatively wealthy in the United States, right? God's been good to me. I have a good life as a surgeon at Johns Hopkins. Most of America has less than $500 of cash in savings. They live a very different life, and healthcare has forgotten them. And we refer to them as if they've done something wrong, like they've been irresponsible and failed to get health insurance. No, these people have health insurance. Our research shows that they're insured, they're working. The most common place they work is Walmart. Number 2 is U.S. postal workers, workers at Lowe's, nurses and housekeepers at hospitals being sued by their own facility. We did the expose on Mary Washington Hospital. We're now looking at UVA, which gets taxpayer funding and sues a lot of people. Memphis, the Baptist system just highlighted in ProPublica, in New Mexico. So we're finding hospitals around the country that are violating the public trust of our great medical profession. We're calling them out. We're doing this at restoringmedicine.org. And so far, the first hospital that we talked to has announced they are going to stop suing patients.
Would someone have recourse to say that they were sort of in a situation of duress when they were in the situation where they sort of agreed to receive certain treatment? Because in certain emergency situations or even urgent situations, you're not exactly sort of calmly stepping back the way you would if you're thinking about choices for buying a car and making a decision. You're in a situation where a doctor says this is the procedure you need. Then later you end up getting sued for something which I would argue there is a sort of analogous duress type of situation. Is that recourse that these lawsuit victims can sort of try to employ?
Yes, but David, to be honest, they're too scared. They are served at home by a sheriff's deputy that wakes them up at 7 in the morning, we found in some cases, and they're told to come to court, and they come to court and are asked a question, do you owe this money? They're afraid of perjuring themselves. They don't really understand what's happening. They just say yes, and then they have to provide their routing number and account number in the back of the courthouse to the hospital, who pulls the money out of their savings, or their paycheck is garnished, or a lien is put on their home. We have been representing patients pro bono as best we can. I will list my name as the medical expert on their case for free. And I will argue to the judge, the patient doesn't owe the money. I can't mow your lawn and charge you $50,000 without a contract. There's got to be an agreement. Many people are asking, I want to know the price of what it's going to cost to deliver a baby beforehand. 60% of medical care is shoppable. That is, it's elective, right? No one's suggesting we give you a price if you get shot and need to have a heart valve replaced in the trauma bay. Okay, we're talking about elective care. Hospitals can get their act together, physician groups, healthcare, the elite, the medical establishment, and figure out a way to do honest and fair, transparent billing to patients and give them a price before the service. Many of these patients sued, asked for a price, and were told the runaround, the typical runaround that's common in hospitals. If you are somebody paying out of pocket or out of network, which is a fast-growing group of Americans, and you need to deliver a baby, don't you think you should be able to look up what it costs at different hospitals, assuming it's an uncomplicated delivery? So we've argued to the judges, there is no valid contract. People come to us in a hospital under duress. They are stressed, they're scared, right? When I see a patient in the emergency room or in my clinic who was told they have cancer, there is one emotion that dominates their mind, and that is they're petrified, they're scared. We have historically been a refuge for people when they are hurting. Now we've got patients in the community saying, in Virginia, one woman said, I'm at home and sick and scared to go to the hospital. They've sued me twice. That is violating this great public trust that we've had. And I think doctors and nurses and everyone at a hospital are starting to speak up. And we're seeing this now with our Restoring Medicine Facebook page and other venues.
The book is called The Price We Pay, What Broke American Healthcare and How to Fix It. It's available now on Amazon. And we've been speaking with the book's author, Dr. Marty Makary. Thanks so much for talking to us about this today.
Great to be with you, David.
The David Pakman Show at davidpakman.com. The David Pakman Show at davidpakman.com.
All right, we've been waiting for this. We now have 3 new polls after last week's Democratic primary debates, and it turns out that my analysis of who did well has translated directly into polling changes, and I want to go over those with you today. The big picture is Joe Biden is down. Bernie Sanders and Elizabeth Warren are basically even, Warren up slightly. Kamala Harris got the biggest boost, while basically all of the zeros and ones, the people polling 0 and 1 or even up to 2%, are basically unchanged, and some of them probably should start getting out of the race soon, and we'll talk about that in a little bit. So to remind you, my analysis was that on the first night, Elizabeth Warren won. She was the strongest on policy. She didn't win in dramatic fashion. She didn't have any of those big gotcha type moments that unfortunately in the modern political environment are considered signs of strength as a politician. I also thought that from night one, Julian Castro and Bill de Blasio did well, but they didn't have a chance and they continue not to have a chance. On night 2, Kamala Harris was clearly the winner in the way that a mildly involved Democratic voter would see it. Very strong and commanding. Pete Buttigieg sort of in a quiet second place. Bernie Sanders maybe right there with him, maybe in third place. Bernie likely not doing damage, but not really making any big gains, was my impression. And the poll results basically have confirmed that that's the way that on average, Democratic voters understood the debates. So looking at the averages of the 3 recent polls rather than at any one poll, Joe Biden's polling continues to trickle down. That's the green line at the top for people who are watching. Bernie's polling is basically even, the slightest uptick, about half of 1 point. Elizabeth Warren continuing this slow and steady climb that goes all the way back to early April. And then the biggest jump very clearly is that orange line on the chart, Kamala Harris. Harris gained more than 3 full points. She's now within striking distance of Elizabeth Warren for third place, who herself is now within striking distance of Bernie Sanders for second place. And if Joe Biden doesn't turn this trend around, Joe Biden actually risks falling out of first place before he knows it. You will also notice that the zeros and ones, as I call them, the people basically polling nothing, have not really moved. None of those lower down in the polling have moved the needle. Marianne Williamson was polling almost, has been polling almost literally 0. She's now at 0.2%. That may even be a drop from before the debate. I don't remember. Jay Inslee is at 0.3%. Bill de Blasio is up to 0.7% from, I think, like 0.5. I mean, this is basically all 0. So in total, Williamson, Inslee, de Blasio, Delaney, Bennett, Castro, Ryan, Bullock, Klobuchar, Seth Moulton, who wasn't even in the debates, and Kirsten Gillibrand, all under 1%. And then you have Tulsi Gabbard and Andrew Yang between 1 and 2%. Now, those two are interesting names. Yang supporters were hoping that Andrew Yang would explode after his participation in the first debate. Hasn't happened. Admittedly, he didn't get much of a chance to talk. Tulsi Gabbard supporters loudly saying before the debate that she was going to explode as soon as the country became more aware of her. Her polling hasn't moved at all either. And it's interesting to note that there was a lot of bragging after the debates from supporters of some of these lower polling candidates saying X was the most searched for candidate on Google right after the debate. They're going to explode in the polls. And what I was saying at the time, and clearly is true, is that just because a lot of people are Googling someone's name doesn't mean they're impressed with them or plan to vote for them. For example, Marianne Williamson was saying wacky things, and no one knew who she was. So it makes sense that a lot of people would start searching her name on Google to figure out who she is, not necessarily to vote for her, and the polling seems to bear that out. Tulsi Gabbard, I hate to break it to people, but she, a lot of the searches for Tulsi Gabbard were because she did make Tim Ryan look really stupid on that issue of the Taliban. Also, if you looked at a lot of the comments online, it clearly appears that there are lots of men who are quite taken, and women potentially, quite taken with an attractive 30-something-year-old candidate, and they didn't know who she was, so they were Googling her name. It is not translating into polling growth, at least not in the 3 post-debate polls so far. Andrew Yang, again, lots of searches for Andrew Yang, picked up a lot of Twitter followers, doesn't mean that this is someone whose Google searches are necessarily going to translate into polling support. So the question now starts to become, how long are some of these zeros and ones going to stay in? For those who were in the debate, they don't seem to have gained polling support, and that's something they're going to have to think about. The zeros and ones who didn't even make the debates, which are Seth Moulton, and there might be one or two others, it's just time for them to go. I mean, they never had a chance to begin with, and they should go. On the show tomorrow, I'm going to address a question that our audience is very divided about. The question is, when does this polling matter? In the sense of, historically, when do polling numbers start to reflect who is likely to actually secure nominations? The answer is it's right around now, but I'm going to go into detail about that on tomorrow's program. Lastly, there are people who are emailing me saying, David, you should not be looking at national polls. You should be looking at the Iowa caucus polls, because that's the first caucus. I believe it's in January, February, and that's going to set the tone for how the entire primary goes. Yeah, I mean, it's fine to do that. It's not actually that interesting yet, because right now there's this 15% cutoff in the Iowa caucuses. If you don't get 15% support, you don't get any delegates from the Iowa caucus. Right now, it would just be Biden and Sanders who get any delegates from Iowa, and that's the way it's been for a while. So in fact, that hasn't really changed. No one else is polling at 15% in Iowa, although I believe Pete Buttigieg is close, maybe at 12%, just shy of the 15% requirement. So yeah, we'll start looking at Iowa when it's actually closer. Right now, the national polls actually do tell us quite a bit. If you disagree with me, let me know. I've been open to having my mind changed about this for months, but so far it's been more or less as our analysis has predicted. As some of you may know, the anti-choice Republicans in the United States have been pushing all sorts of bills that would qualify a fetus as a person, and thus it would open up the door to a lot of what I would consider really problematic possibilities. Like, for example, prison for mothers who have abortions, prison for doctors who perform abortions, murder charges for abortions, manslaughter charges for miscarriage. I mean, really ugly, backward stuff. And one of those states is Alabama, and it has just gotten really disturbing there. Actually related to a story that's not directly about abortion, but we need to sort of think critically about what the implications here are. Now, before I get to the full story, this is the type of story that I believe is important to cover, but this story is going to be demonetized by YouTube. We've been talking about these issues on YouTube. YouTube's an important revenue source for us, but these are important stories for us to cover. So consider supporting us with a membership at davidpakman.com so that we can just keep covering the stories that deserve coverage and not have to worry about how it's going to impact the show's revenue. So the story is as follows. A 27-year-old Alabama woman was shot in the stomach while pregnant, and she was shot by another woman, and being shot in the stomach resulted in a miscarriage. She is now being charged with manslaughter for that miscarriage, which of course is connected to her being the victim of a shooting. So there's a whole bunch of details here that can be discussed. One is that the fight that led to the shooting was between the pregnant woman, Marche Jones, and another woman who were fighting over the fetus's father. The shooter, Ebony Jameson, was charged with manslaughter initially and not indicted by a grand jury, so that charge was dismissed. Now, Jones has been indicted on a manslaughter charge. The argument being made by police in Pleasant Grove, Alabama, is that the mother instigated the argument with the other woman, that the victim here is the unborn fetus, and were it not for the instigation of the mother, that none of this would have happened. Therefore, the mother should be charged with manslaughter. Now, you might laugh this off and say, Alabama, this wouldn't happen anywhere else. That's not true. There are 38 states that classify fetuses as victims in homicide or assault. And the truth is that sometimes that does make sense, okay? If a burglary gone wrong leads to a burglar shooting a pregnant woman, and both the woman and the fetus die, the fact that there was the potential for life there, and that 2 actual or potential lives were cut short, should be considered by the law. The problem is that in places like Alabama, it's being applied in really ridiculous ways that truly stretch credulity and require, I'd call it imagination, and in a sense are criminalizing of pregnancy. And the reason that lots of anti-choice activists love this indictment is they understand the long game, and they see that prosecution for an abortion is only half a step beyond what we're seeing in Alabama right now. So understand that in reading the details of the situation, it may well be that the mother instigated or escalated or perpetuated this disagreement with the other woman, but escalating the fight or the argument doesn't excuse the person with the gun who decided to do the shooting, which led to the death of the fetus. And it will be used by the anti-choice right to push for changes that would open the door to and encourage criminal charges for women having abortions. So there's a lot of disagreement on this one, even including within some enclaves of the left. So I want to hear from you about it. What do you think about this? Research the details of the story first, and then let me know what you think. We have a voicemail number. That number is 219-2-DAVID-P. Gavin McInnes is one of the founders of an extremist right-wing group called the Proud Boys. He has a new program. That program is advertising on YouTube, interestingly. And here's a voicemail I got pointing out a very strange double standard. Take a listen.
Hey, Dave. This is Tyler from Alexandria, Virginia. Calling because I was just watching YouTube and I saw an ad for Gavin McInnes' show and was just completely shocked that with all the demonetization going on, that someone like him is allowed to advertise. YouTube clearly doesn't care anymore about what content's acceptable to make money off of. And just want to say I've been a member since 2016. And anyone who values the work you do should pitch in any way they can so that you can completely stop depending on YouTube. Thanks for the work you do. Have a good one.
Thank you. And it is stunning, right? YouTube is really scared about putting ads on content that is supposedly not brand safe, including demonetizing a video of mine where I just played clips from a Donald Trump press conference. And meanwhile, the completely not brand safe Gavin McInnes, who founded an extremist group named the Proud Boys, is actually part of YouTube's advertising program and is running ads on YouTube. It's backwards, okay? And the solution is to separate content and advertising, make programs that you like independent of ad revenue, whether it's the David Pakman Show or others, that's your call to make. Very, very disturbing reality is what's going on. We've got a great bonus show for you today, one of the many member benefits. Hope to talk to you then.
The David Pakman Show at davidpakman.com.